Every parent or caregiver should know how to administer CPR. CPR stands for cardiopulmonary resuscitation, a combination of rescue breathing and chest compressions. When performed correctly, CPR can save a life by restoring breathing and circulation until advanced life support can be given by healthcare professionals. CPR may be necessary for children during many different emergencies, including near drowning, suffocation, poisoning, smoke inhalation, electrocution injuries, and suspected sudden infant death syndrome. Knowing how to perform CPR can prevent the loss of life resulting from an emergency, such as drowning, suffocation, or trauma. Your actions can keep a child alive until emergency services arrive. Performing CPR is not difficult, and any attempt is better than not trying at all. Without CPR, your child may have no chance of survival. Here's Liz and Janet and Joey from St John Ambulance. They're here to show us just how easy this can be.
Be prepared for emergencies by familiarising yourself with CPR and first aid procedures, and by keeping a list of emergency numbers stored in your mobile phone or near your home telephone. When a life-threatening incident occurs, there is a simple action plan which can be used. D, R, A, B, C, D. Let's go through these now. D, danger. R, response. A stands for airway. B for breathing. C for CPR. And D stands for defibrillation. Danger. Quickly look around to ensure you are not putting yourself in any danger. This can include loose electrical wires or leaking gas outlets. If it is safe to do so, approach the child. Response. Check for a response. Ask the child their name or ask them to squeeze your hand if they can hear you. An infant under the age of 12 months is unable to do this. Check to see if they are crying or responding in any way. Airway. If the child is unconscious, check their mouth for anything blocking their airway. This could be their tongue, toys, food, vomit or blood. If foreign material is found, roll the child onto their side, keeping their top leg bent. This is known as the recovery position. Clear any foreign material using your fingers. In the case of an infant under 12 months old, use only your little finger to clear the foreign material from their mouth. If the child or infant starts breathing once the airway is clear, leave them on their side in the recovery position. Breathing. Once any foreign material is removed, roll the child back onto their back and check for breathing. Listen for the sound of their breath. Look for movements in their chest and feel their breath on your cheek. If the child is breathing, gently roll them onto their side into the recovery position, phone 000 and check them regularly for continued signs of life until the ambulance arrives. CPR. If the child is not breathing, you should commence CPR. Place one hand on their forehead and use the other hand to lift their chin slightly so their mouth opens. Seal your mouth over their mouth. Pinch their nose gently and blow in enough air to see their chest rise. You should give 2 quick breaths. These are called rescue breaths. The CPR technique is slightly different for an infant. If the baby is not breathing, maintain their head in the neutral position. Lift their chin to bring the tongue away from the back of the throat, opening their airway. Take a breath and seal their mouth and nose with your mouth. Blow gentle puffs into the baby's mouth and nose. Watch for the rise and fall of the chest. Take another breath and repeat the sequence. If there are no signs of life and the child is not moving, not breathing and not responding after the 2 initial breaths, make sure someone has phoned 000 and then commence chest compressions. Position the heel of your hands in the centre of the child's chest, interlacing your fingers. Using the heel of your hand, push the chest 30 times. You should give about 2 compressions per second. Each compression should depress the chest by about 1/3. If there are no signs of life in the infant after 2 breaths, position 2 fingers in the centre of the chest and give 30 compressions at a rate of about 100 per minute. Each compression should depress the chest by about 1/3. After 30 compressions, take a breath and seal your mouth over the child's mouth. Pinch their nose and give 2 rescue breaths. In the case of an infant, seal the baby's mouth and nose and give 2 gentle puffs. Look for the rise and fall of the chest. Continue giving 30 compressions followed by 2 breaths until medical help arrives. If signs of life return, move the child into the recovery position. Continue to monitor breathing and be prepared to recommence CPR at any time. Defibrillation. The last action to be taken is defibrillation. In the case of a child or infant drowning or suffocating, it is unlikely that defibrillation will be of assistance. Paramedics arriving at the scene will be able to determine whether defibrillation is necessary. As you can see, the techniques to perform CPR are very simple, but they can make all the difference in saving a child's life. Remember, stay calm, phone 000, follow the DRABCD action plan, 30 compressions to 2 breaths, and any attempt at CPR is better than no attempt.
This section of the DVD is not a substitute for CPR training. I find it easy to remember the DRABCD action plan as Doctor, ABCD. Formal CPR courses are available from a number of service providers, including St John Ambulance and the Royal Life Saving Society. I hope you've enjoyed this CPR section. However, I strongly recommend you enrol in an accredited CPR course